So we move to the fourth talks of this symposium. So may I introduce Dr. William Housworth. Dr. William Housworth and his wife, Dr. Laurie Housworth, are both board certified in internal medicine and pediatrics. They also hold MPH degrees from Harvard, William with a focus on humanitarian studies and Laurie on infectious disease. They have lived and worked full-time in Cambodia since 2008. Initially, William directed the Angkor Hospital for Children in Siem Reap, where Laurie founded and run the sexual abuse clinic. They together subsequently found Chenla Children's Healthcare in 2016 with the aim of helping correct some of the extreme outcome disparities seen in pediatric healthcare in the most rural provinces of Cambodia. They have worked in collaboration with NUH throughout their time in Cambodia. So may I now invite William? Thank you very much.
Thank you very much. Thank you, Professor Roy and committee for inviting me to this conference. I want to start by explaining a little bit. I'm mostly full-time in Cambodia, but actually for 14 years, I spent 3 months a year in the United States working full-time as an emergency room doctor, and then 9 months in Cambodia doing this with my wife, Laurie. Laurie couldn't be here today. She was invited, but she gives her apologies not being able to make it. We have a nephew back in the States who is getting married as we speak, I think. And I just want to, since this was recorded, I want to give a shout out to Adam and his new lovely wife, Kristen, and congratulations, and we wish you well in life. I also want to say, again, as I was invited to do this, the first person I told I was invited to do this, of course, was Laurie. And I told Laurie I'm invited to do this, and she says, well, you got to promise me, don't screw it up, because I want to come back and talk next year. So next year you can look forward to an uplifting conversation about the medical ethics of sexual abuse clinics in an unruly nation. At any rate, we both run and established in 2016 something called Chenla Children's Healthcare. And I think that was a very good description of it. Our mantra, compassionate healthcare where it is needed most, is kind of what gets us into trouble. It's what the ethical dilemmas come out of. And there are quite a few. Our mission, if you just read what's on the website, Chenla Children's Healthcare mission is to deliver holistic pediatric care and clinical outreach in surrounding communities in eastern Cambodia affected by poverty and disease. Working in direct partnership with the Ministry of Health of the Royal Government of Cambodia, Chenla provides patient services children need, improves the infrastructure and health systems of the provinces, and improves health worker education in the region. But you can't really believe what you read. What we do is we basically go province by province in the rural parts of Cambodia and the darker shaded areas where the highest child mortality is. And we go to the provincial hospital and we work with them and we say, hey, we see what you're doing right now. You only have a few beds, you don't have much supplies, you only have a few doctors and nurses assigned to the ward. What can we do to help you? Can we partner? Can you keep putting those inputs in? And then our NGO, with outside funding, will come and work with you to put better inputs in, both with doctors, nurses, physicians, training, but also supplies, equipment, and that type of thing. And together, we make a difference pretty quick in some of the outcomes we see. There's lots of questions about sustainability and these type of things. Now, when I was thinking about the ethics of doing this, I was thinking to myself, well, how should I figure out what are the ethical dilemmas of doing this? So I thought, I'm going to ask people in my home community, what do they think? So the first person I asked was a pastor friend of mine. I said, what do you think the ethical dilemmas are of what we do in Cambodia? And the pastor says, there are no ethical issues. You're just helping people. It's a wonderful thing you're doing. There can't be a problem with it. And so on the one hand, I think, well, maybe it wasn't so much help. On the other hand, he's actually very motivating for us to do this type of work. You have to have motivation in the background to do this. The second person I asked was quite interesting. I was sewing up a lady's hand in the emergency room in rural Kentucky at 2 a.m., and I'm chit-chatting with her, trying to describe to her what we do and why we do it. And I say to her, after I tell her a little bit about it, she says, what do you think? Her immediate response was, well, that's awful. It's like, what do you mean that's awful? Well, we have plenty of needs right here in Kentucky. Your wife's a doctor. You're a doctor. Why in the world would you go do this somewhere else? And actually, she said, why would you go and do this in Africa, to be blunt, what she said. Geography aside, she has a point. The point is, what's the reasonable allocation of healthcare resources? Where should you apply them? How should you apply them? And should it be the state's responsibility? And what's the role of an NGO like we are? We take donor funds to make this stuff work. Is that ethical or not ethical? There's plenty of questions that I think she adequately raised. The third people I asked were actually Lori's parents. What do you think about us doing this? Their immediate response was, well, that's all fine and dandy. Don't hurt your children. Don't hurt our grandchildren. Take care of them. If they do okay, then you can go do your thing in Cambodia. And now the fourth person I asked was Dr. Tina Slusher. Some of you may know she's a pediatric intensive care doctor at University of Minnesota, and she's been involved with us at Chenla for a long time. But she's also helped establish neonatal ICUs in Nigeria and other places over time. And this was back in 2016 when we were first starting, and I said, Tina, what do you think? And she said, well, Bill, it's good that you want to start in eastern Cambodia. It's good you want to help these provinces with their limited resources. But whatever you do, don't start an ICU. Don't start using ventilators. Don't do higher level care that might cause harm. You've got to take it slow and easy, which brings me to our case. I'm not a very good person at listening to my mentors sometimes. We have an immediate need in front of us, and so what do you do with that immediate need? Should this be attempted? Should we be able to run an ICU in a rural place that has very limited resources, or should we not? Should we not take the risk of doing the harm? At what level? Who gets to decide this? What if it's not sustainable? Let's say we did this for several years and the donors and the people supporting us and the intellectual support of what we do, what if it all dropped off? Would we have done good? Would we have done harm? An important aspect is how do you judge yourselves? Someone like Lori and I, we do like to go do things. We like to start something. We like to make something happen. That's great. But who gets to judge whether we're being safe and effective or not? Certainly we put in internal controls, but those internal controls are our Cambodian doctors, nurses, data collectors, people who have a biased interest in the whole thing working. So how do we have unbiased people from the outside also come in and do assessments, and how do we share those? Which also begs the question for sustainability, in that, okay, we're going to share these assessments of doing this type of work in a very rural place, and we're going to have some failures. We're going to have some screw-ups. How do we convey that to the very funders and convince them that our failures are not going to be overlooked, that we're going to prevent them in the future, and that we're going to keep going in a safe and effective way? And that's not easy to do as you manage an organization. Now, the point of this slide is that foot. You can see where the fang, if you look at the base of the big toe, you can see where the fangs went in. So that was most likely a cobra that got that kid. But lo and behold, with our ICU system, we were able to provide life support immediately. The kid came in not being able to breathe. And we're able to obtain the antivenom that is actually available in the public system with some effort to get it to us. We sustained the kid long enough to get him the antivenom, and eventually he came off the ventilator and lived. We took a risk. It worked. There's a success story. That doesn't mean it's all a wise thing to do. I think the bottom line for this is it's a team effort. We need transparency. We need help from the outside. We need partners. We need people in a collaborative form to come together to do this. It requires careful oversight internally and externally. It requires data collection, which is no easy task in a public system like this in rural Cambodia. True data collection, it's easier to get junk in and junk out than it is to get true, careful data about even just simple patient numbers. It's not easy in the public system always to collect clear data. And another question about this type of work is, okay, is it okay or not okay to be personality driven? You know, if you read Atul Gawande's books, he gives an example of CF clinics, cystic fibrosis clinics in the United States, where some clinics that touted themselves as being high-quality centers actually didn't have as good of outcome as the smaller centers that were more personality-driven. So is it good or bad to have a leader who really, really wants excellent outcomes? Lastly, my final thought. When I was training and I got to my residency program, there was a director of it, a gentleman named Dr. Billy Andrews. And Billy drove me nuts. I was a young doctor and I wanted to learn details. I wanted to learn the best way to practice medicine. And Billy would always talk in these big, broad generalities. But as I get older and do this over a longer period of time, I realized Billy was right. And one of the things he said, the level of civilization attained by any society will be determined by the attention it is paid to the welfare of its children. And I think this is a strong argument to at least attempt what we're doing in rural Cambodia and absorb the ethical challenges over time, some of the guilt that we feel, but also to try to improve. Thank you very much.